Tim Driscoll. I'm with Asheville Buncombe Community Christian Ministry, and my role in the organization is Director of Service Coordination. ABCCM operates a transitional housing facility for male veterans, a transitional housing facility for females and women and single mothers, an emergency shelter for families, a sober living facility for individuals coming out of inpatient treatment, and a veterans portfolio that includes housing, employment, service coordination, outreach, and suicide prevention. The work that we do with Unite Us started about 10 years ago when we began providing service coordination for veterans and their families in the state of North Carolina, specifically one of the four networks that was developed within the state. It's grown to consolidate under one coordination center. We now operate a predictive analytics program that's powered by the Unite Us technology, and we have systematically woven the Unite Us technology into every aspect of our organization. Over the last 10 years, I think one of the biggest lessons that we have learned, and not just via Unite Us, but the truth is we recognize that when we engage with technology providers in any form or facet, we're looking for partners, we're not looking for vendors. And so Unite Us has been integral in that role of being a true partner and not a vendor. When I say that, I mean they understand what we're trying to do as an organization. They understand where our long-term goals are as an organization, and they're actively working to support those goals. In rural regions, the most unique challenges that we face, which have also opened opportunities, is you find yourself in what we kind of describe as provider deserts, right? For every person that needs a service, there's not always a locally available resource to meet that need. What that's done is it's enabled us to be kind of a little bit more creative in how we procure the resources necessary. We've been able to make partnerships and leverage some more national level agencies and entities to support individuals in rural communities that otherwise would not have been able to access them. The biggest milestone that sticks out to me is, there's two. There's the launch of our predictive analytics pilot. Historically, we've done a very good job at meeting veterans where they're at in their time of need. What predictive analytics enabled us to do was really engage with a population that we historically hadn't been able to engage with until it was too late, right? So utilizing that particular feature of the technology, we were able to address some issues within the widow community. We were able to really leverage and prevent some higher level interventions from being necessary. The other one that stands out is we celebrated our 10th year in service to North Carolina, and the Unite Us team was phenomenal because we wanted to put out a 10-year report for the state and for, frankly, our communities that have participated and been a part of this growth. And so we had buy-in from the Unite Us team from day one. I think the biggest thing that the predictive analytics pilot has unearthed is a desire to do things differently, and we've discovered the first iteration of what that could look like. And so We know currently what the landscape and what the face of social care looks like. We know what case managers in reactionary programs can do and do every day. I think when we launched predictive analytics, it really kind of ignited a fire in us to continue to push farther upstream and come up with new and innovative ways and really look to our partners for new and innovative ways to address these needs. Hurricane Helene hit almost a year ago to the day, I think 1 year and 1 week ago. And the interesting part of the whole situation was that was not the first time Unitas was leveraged in the state of North Carolina following a natural disaster, specifically a hurricane. During Hurricane Florence, when the coastal network was shut down, we were able to shift operations to the Western network. So we had a blueprint of what right could look like, but the benefit was the network had matured and grown so much over the previous 5 years leading up to Hurricane Helene that because of the way the network was displaced, we were able to continue providing services and really operationalize some of the initial resources and programming that was made available immediately following the hurricane. We utilized Unitas to put over 30 veterans in hotel stays immediately following the hurricane. We completely lost one of our veteran facilities that was housing 180 veterans. Our community was in shambles, and everybody was looking to help. Unitas staff actually came and volunteered at our warehouse, unloaded trucks, packed food boxes for the community. I don't know if y'all know that. So, yeah. 5 years from now, my hopes would be that as we continue down this road of partnership with Unitas, there's a desire to continue looking at what the next thing is to address care, right? That I think we've been fortunate in this partnership because neither side is willing to accept things as they are today. And so in 5 years, I'd like to be in a place where we've found the next answer and we're moving the needle on social care issues all across the state, as well as being able to highlight that model for the nation to follow.